Good afternoon, everybody. My name is Ebony, and I go to WCU Dallas. I'm writing a review on the article Hand Hygiene and Back to the Basics of Infection Control. The article was a part of a study from the Indian Journal of Medical Research. The article was produced by Dr. Martha, assistant professor. The article discusses the recent increases of hospital associated infections, also known as HAI, and how implementing basic hand hygiene can decrease the amount of infections. There are a number of infections that are spread through hospitals due to the lack of hand washing. The study was performed to bring awareness to hand hygiene in the United States and in third world countries. So, as we know, it's not just a problem in the United States. Other countries deal with it as well, as far as people catching infections due to our lack of being sanitary and efficient when it comes to that. The study focuses on adherence to recommended hand washing practices, safe hand washing methods, and methods of transmission of bacteria. Hospital-acquired infections, also known as HAI, as I mentioned before, are increasing attention for patients, insurers, governments, and regulatory agencies. I'm sure their families as well, and anybody else who is staying in the hospital for a long period of time. This is not only because of the magnitude of the problem in terms of associated morbidity, mortality, and cost of treatment, but also due to the concern that the infection is preventable. I know whenever you go to a hospital, you can see that there's always hand sanitizer at the door, there's gloves, there's always sinks for you to wash your hands. It's all preventable if you take the right precautions. The article's hypothesis states that there is now dispute evidence that strict adherence to hand hygiene reduces the risk of cross-transmission of infections. The hypothesis is supported, and as I said, whenever you go into a hospital, you always see hand sanitizer, and even outside of hospitals, you always see signs that say employees must wash hands, just to prevent the chance of somebody catching an infection that they didn't need to catch. That does cost the hospital more money, and it costs the patient more money as well. The article selected method of research targeted multifaceted approaches focusing on system change, administrative support, motivation, and ability of alcohol-based hand rubs, training and intensive education of HCWs, and reminders in the workplace have been recommended for improvement of hand hygiene. So, there was a number of positive results. There was also some negative results from this as well. But we do know that letting people know and helping people be more aware can cause them to pay attention more to the fact that they do need to wash their hands when dealing with the patient, especially because you don't know what you can be contaminated with. And then not only are you going to pass it to yourself, you can pass it along to another patient just by not being careful. The strength of this article included evidence dating back to the 1900s, and it did continue into current time because there was a lot of research on this topic. The strength of the article also included scientific research on how infections can spread through direct contact. I like the fact that the article discussed the natural flora of human beings and how microbes continue to live on surfaces such as clothes, linens, beds, and counters, which we know there's a lot of those in there. There's always counters in hospitals. There's break rooms if patients are staying there for a long period of time. There's stoves to cook and countertops where people prepare their food. They're definitely staying in beds, and they do have clothes on, and there's family members who may stay there for long periods of time as well. So that was definitely something that I loved that they mentioned within the article. The limitation was the lack of actual statistics, but I guess that's what makes it a different type of research. It's qualitative versus quantitative when it comes to the amount of statistics. The article continued to give examples on how hand washing decreases the transmission of bacteria. However, it didn't give any numerical data. As I stated, no statistics. For example, how many patients were infected per day and the sample size of the research. But again, that's what makes it a different type of research. I chose the article to review because it addressed the aspects of hand washing and hand sanitizing perimeters. The article was very detailed in research and gives evidence to back the research. So that's always nice that, they did, although they didn't have statistics, they did have information to back what they were saying and what they believed in within this article. The article was extremely helpful. It was interesting. The most interesting highlight of the article was the fact that hand hygiene is proven to reduce transmission of bacteria and reduce hospital-associated infections. However, adherence to recommend hand washing practices are still extremely low. The article was informative and clearly written, so that was also a plus. And definitely, I could use this research as a part of safe practices within my nursing career and also just within my everyday life. People do get sick within your family, and it doesn't only have to be patients, so they can get sick and you can have to stay in a hospital for an extremely long amount of time. So you just want to be aware and educated, whether you're working or off the clock, on how to prevent infections. You always see it everywhere that you need to, again, wash your hands if you're an employee. If you're not an employee, just being like prepared and taking precautions can prevent so much and so many costs, because people do catch things. There's respiratory infections that can be caught through not washing your hands, and other types of infections. You can get pneumonia, things like that, through just like, it takes 1 second to, when you're walking out of a room, to wash your hands. And they say that like hand sanitizer is good if you don't get bodily fluids on you, but if you, in the event that you do, it's also good to wash your hands with soap and water. And that was also mentioned in the article as well. So they did have a lot of good information. It's low cost to have hand hygiene. It doesn't cost much of anything. It's just taking the time out to be effective and efficient. I did feel like they made a connection between the exposure and the diseases and infections that can be caused, and how it's quite simple. And there was a lot of scientific evidence to back that. And as I said, although there was no statistics and no numbers, they were able to make a valid point. Thank you. You guys have a great evening.